I'd like to welcome everybody to this public meeting. This is a public meeting organised by Tower Hamlets Unison local government branch, and it's been organised as a response to community concerns about a number of proposed cuts to council services which were announced in mid-September and have been put out to public consultation. What was proposed was what's been proposed is of serious concern. Many of the proposed savings options concern services for vulnerable people, such as adults with mental health problems, children with special needs. I don't know whether you've seen our flyer advertising tonight, but it lists the full sort of range of the most concerning cuts, which range from closing the in-house home care service in April 2015 instead of 2016. Also looking to shut 4 of the local authority nurseries, shutting one of the Tower Hamlets children homes, and axing an entire social work team from the children and adolescent mental health service. What has been proposed is concerning, but also what the method by which the council is conducting this consultation is also concerning as well. I don't know whether anybody has tried to do the consultation, but essentially it involves logging onto a website and trying to find your way through something like 25 surveys. I haven't tried to do it myself, but the people who I have talked to who have said it takes about 2 hours. So our view is that it is not a genuine and meaningful consultation. Also, many of the proposals are packaged in such a way it's almost impossible to know exactly what's being proposed. While some are very clear, such as closing the 4 children's centres, some are extremely vague, so it is absolutely impossible for the public to comment properly on something which is as vague as mist. Right, in response, Tower Hamlets Unison arranged a very noisy lobby of the council cabinet meeting, which was held on the 1st of October. It was a very noisy meeting, very successful, and as a result of that, in the lodging of the petition, the Mayor has agreed to extend the consultation period by 2 weeks. So now this meeting is an opportunity for service users, residents and staff to come together to give voice to the concerns that we have about what is being proposed and to organise, to fight, to save the services that are important to vulnerable people in Tower Hamlets. Now, we have invited every single councillor in the council to come to this meeting tonight, from all of the political parties, the Tories, Labour and Tower Hamlets First. We've had a number of apologies. Councillor Rachel Saunders has accepted on behalf of the Labour group, and Deputy Mayor Ollie Rahman is come on behalf of Tower Hamlets First. So they'll each have an opportunity to say something later on in the meeting. Right, we've also got some special guest speakers, because while we face difficulties in our own neighbourhoods, the fight against austerity goes on all across London and across Great Britain. So we've got some speakers who are involved in some really key fights going on at the moment. We have Andy Squires, who's from Unison Health up in Doncaster, and he's one of the Care UK strikers who are striking for services for vulnerable adults with learning difficulties and to protect terms and conditions. We've also got Naomi Beard, who is a GP from Jubilee Street Practice, who has led an amazing campaign to save our surgeries, had 1,000 people marching around the borough to protect health services for our residents. And last but not least, we have Helen Davis, who is the chair of Barnet. Now, if anybody knows anything about Barnet, it is a very severe, conservative, outsourcing authority where they've outsourced pretty much everything but the kitchen sink. And the Unison branch up there has just launched an amazing fight to try and to stop that and protect services. So we're all going to hear from them a bit later on. But firstly, I want to welcome a very special group of mums. Ever since this consultation was first launched, these mums who have children who go to one of the day nurseries, Queen Mary's, have launched an amazing fight back to save their nursery. Many of their children have disabilities and special needs, and these mums are absolutely devastated at the thought they could lose this excellent childcare facility, which has been so important to their children. They have tried to get a meeting with the Mayor. That was unsuccessful. They've launched a petition. They've been gathering signatures and protesting down at Bethnal Green Tube. And if anybody has seen the latest Docklands and East London Advertiser, they've made the front page. So I think we really need to give these mums a great round of applause. Can the mums come in, please? That's great, that's excellent, and we're going to have an open mic later on, so we're going to hear a lot more from the Queen Mary nursery mums about the action that they're taking to save their children's nursery. Right, now I'm going to hand over to John McLaughlin to say some opening words. John is the branch secretary at Tower Hamlets Unison.
Firstly, thank you for everyone for coming tonight, and I'm really proud and privileged to be alongside the parents. I mean, sometimes people say you need to be realistic. You have to make cuts. Is it inevitable? And I'll tell you what I say. I would rather be here on the side of people fighting against the cuts than be part of making them. And I'm very pleased to see Ollie Rahman tonight in the audience. I want to say something because people may not have heard, or perhaps they have. Ollie Rahman, who's Deputy Mayor, 2 days ago was marched out of his workplace, where he works as a civil servant in Stratford, marched out and told he can no longer work with the public in the front line because he's a Deputy Mayor at Tower Hamlets. That's an absolute scandalous attack on him as a trade unionist and on civil liberties. And I would like to start by inviting the meeting to send a message of support to Ollie, because whatever discussions we may have about other things, we absolutely stand alongside Ollie and the Mayor when they're attacked by Eric Pickles or the Tory government. So I'd like to start by doing that, Ollie. But I am going to say a few things, because it is true that the source of these cuts is David Cameron and the Tory government. £70 million worth of cuts in Tower Hamlets. And this is a government who, if you didn't know it before, care nothing about people like us. The people who've been following. The man who talks about disabled people, that they're not fit to get paid, even the minimum wage, that perhaps they could get jobs for £2 an hour. These people don't care anything about communities like ours. But I would say to Mayor Rahman, surely it's better that you then need to stand alongside communities like ours against the government. And there's one thing that's really been winding me up. I don't know if you've been following this PricewaterhouseCoopers. They've been crawling all over our councils. In my opinion, completely fake allegations about the council, racist, in my opinion, and Islamophobic attacks on our mayor, that somehow we're scribbling money away. I don't believe any of that at all. But I'll tell you what makes me really angry. There'll be a bill coming. And there'll be a bill for millions of pounds to pay PricewaterhouseCoopers because Eric Pickles changed the law the day before he sent the council to Tower Hamlets. And I would say to the Mayor, and I'd say to Ollie, why don't you refuse to pay that money and instead make sure that money goes to saving the services that are under attack? Because I think it's clear we're able to face the Tories together, but we need to make sure we're uniting our communities. And you cannot say, and I've heard it said, we're trying to make cuts, but we're trying to make them in a way that doesn't hurt the vulnerable. Well, I put it to you. You can't talk about disabled children closing their nurseries and say they're not vulnerable. You can't talk about closing the in-house home care early and say that people aren't vulnerable. You can't talk about services for children and adolescents in mental health and say they're not vulnerable. You can't talk about daycare for the elderly and for people with mental health problems and say they're not vulnerable. It's simply not true. And the only question is this: do we stand together with the vulnerable and the people of Tower Hamlets, or do you simply implement what David Cameron and a coalition government want to do? And we people are really angry, and I'm really angry, because this consultation, the way it's been done, is an absolute disgrace. You know, I've defended, and we have members who work on East End Life, and I'll defend it. But I will not defend for 1 second that East End Life says nothing about these cuts that are proposed. You cannot have a newspaper that comes out and just says, your council, your choice. Doesn't say, by the way, you want to shut all your nurseries. Doesn't say, by the way, you want to shut your home care. You cannot defend that. You cannot hide behind what those are, and you can't hide what those cuts are going to do. And we've invited other people in the platform today, and for good reason, because there's a few lessons, I think, that come out of some of the people who weren't here to speak. Andy's going to speak, and he'll say about Care UK and what happens when you privatise. I'd say back, you can't shut down all our in-house home care and pretend it doesn't make a difference. You can't pretend that quality of care is different. One of the things that makes me most angry, and I really do not understand this, there's a couple of councillors in the meeting room, and I'm not being personal, but I do not understand how we got someone like Robert McCulloch-Graham as Director of Adult and Children's Services here. Where did he work before? Ask yourself the question. Eric Pickles, Troubled Families Unit. Is that someone you'd trust with services into Hamlets? Before that, where did he work? Barnet Council. Now, when you'll hear from Barnet, in Barnet, they privatised absolutely everything. This is a man who says, this is not me making this up, he says in Tower Hamlets, we've provided 2 good services for people, and we've made them too dependent on us. That is honestly what he says. For people in the nurseries, I cannot believe the insight that went into the report of the councillors that talked about our daycare nurseries and said this: we can obtain care of at least as good quality or better in the private sector. Now that is simply a lie. I think it's a lie in general. It's particularly a lie about the 4 daycare nurseries we have, because they are very heavily providing care for children either at risk or who are disabled. You probably hear this later. I was at Overland Children's Centre, and one of the people said to me, part of my funding, one of the workers, part of my funding comes from Hackney. I said, really, why is that? He said, because we provide special support for children with hearing needs, and there is nowhere in the London Borough of Hackney at all, nowhere that provides it. So if you close that Overland, I ask the question, where are these places that somehow you're going to get the other care? Then he says, this is honestly, I'm not lying about this, he says, the trouble is, in Tower Hamlets, we've been too generous with our partners in the past. We're providing services that we shouldn't really be providing. The NHS should be providing them. Someone else should be providing them. Well, there's people who work in the NHS in this room. Do you think for one moment that when services are cut in Tower Hamlets, the NHS are going to rush in and start providing them? Because the same cuts are going on in the NHS, in councils, all over the place. When you cut them, when we cut, we do bleed. We do bleed, because you're taking away services that people absolutely earn. And I will add this one other insult, and again, people might think, believe it or not, I'm often accused of being personal about these. I don't think it's personal. Home care. It can be run just as well in the private sector. Well, you may have read several months ago, there was a home care provider called Magdalish Home Care. And suddenly, the council had to take it over. Do you know why? Because the care was so poor, the Care Quality Commission were going to shut it down. And those people are currently employed by the council. They're going to privatise them again, I think. But they're, oh, by the way, employed by the council on the same appalling kind of conditions if they were privatised. But they say that this will, to sort that mess out, they brought in a consultant, they say. Interestingly enough, I'm sure there's nothing in this. She just happened to be a director at Barnet Council the same time Robert McCulloch-Graham was, but I'm sure that has nothing to do with her appointment at all. There was nothing improper about that. She's employed, and how much do you think to sort out home care? Now bear in mind, they say in home care, our people are paid too well. £500 a day. £500 a day to a consultant while they tell us to make cuts. And this isn't personal, but of that £500 a day she gets, £100 of it pays for her smoking, because every time you go outside Mulberry Place, she's out there having a fag. But this is what they say to us. It's all right to find £500 a day for a consultant, but we can't afford to pay for our services. So we want to send a very clear message this meeting, that people are here today because they say we are not going to tolerate these cuts. We are not going to put up with them. You know, we were outside the town hall a few weeks ago, and we marched around, and I made a bit of a joke, it's like the walls of Jericho, and we've got big trumpets next time. and Mulberry Place might fall down. But if they start going ahead on the 5th of November, when the Cabinet meets, we want to put hundreds and hundreds of people outside that town hall, because we have to let the council know it is not acceptable. We will not put up with it. We will not see our children cast away. We will not see our old people cast away. We are really going to fight. Now, I just want to finish on a couple of things, because I honestly think that that's the mood of a lot of people. We hear about Jubilee Street. We should know Jubilee Street, I think, and Naomi will clarify if I'm wrong, has won. You know, getting 1,000 people out on the streets of Tower Hamlets, it stopped the cuts to the surgeries. It can be done. And right across the country, if you Amanda, I mean, I hope people are going to give Andy a round of reception, because how many days is it now, Andy?
86.
86 days they've taken of strike action they've taken, the longest strike ever associated with the National Health Service. But people are saying is enough is enough. I watched the vote in Scotland, and I must admit I was disappointed that Scotland didn't vote for independence. And I'll tell you why. Because when I heard people speaking, I didn't talk about them, but about how proud they were to be Scottish or how different they were. What they said, we're sick of being ruled from Westminster by a government that doesn't care about working class people, and we want the right to vote for the type of government we want that's about social justice, that cares about services, that cares about working class people, and that mood you get all around the country. But we need to fight. And, you know, I say this with a sad heart to Ollie, but it's no use to people saying we vote through the cuts regrettably. It's no good saying we do it with a heavy heart. I believe our council has got a role to play in leading our community. And they should be leading our community to say we are the borough in the country with the sharpest division between rich and poor. You know, if you go to the south, you see Canary Wharf, and you can see them there, can't you? If you go to the west, through the City of London, I was there on a march with NHS workers, and this is no word of a lie, a banker looked out the window and he waved the wad of notes at us. There is the money in this country, it's just that the people who have got it don't want to give it up. The people who created the crisis are still paying huge bonuses, they're still doing as well as they ever were. We need resistance. And last Thursday, was it, the Mayor stood in front of a packed audience in there, 1,300 people, and people talked about fighting every cut and being part of every resistance. Well, you have to put words into action. And the action's got to be, start by standing to defend the services in Tower Hamlets, not cutting them.
£5 a year. The effects of that range of cuts is one of our stewards has had to give up her rented accommodation. In the last 4 weeks, about 5 people have left Care UK to find employment elsewhere because they can't survive on the drastic cuts. Now, the company that owns Care UK, Bridgepoint Capital, have you heard of them? They own other things like Pret a Manger, Fat Face, Hobbycraft, Virgin Health Clubs, Leeds Bradford Airport. So they have got the money. They purchased Care UK in 2008 for 480 million. That is what Bridgepoint does. They buy up other small companies to make money and move on. Former government officials like Chris Patton and Al Manburn have sat on the board of directors for Bridgepoint. Several times in the last 12 weeks we have demonstrated outside of Bridgepoint Capital on 95 Wigmore Street. That's their London offices. They don't like it. I wonder why. Recently, we have corresponded with numerous American unions in America because that's where Bridgepoint Capital have investments in their pension schemes. So we try that angle because ethically, why should you perceive vulnerable adults as a way to make money? You know, you don't want your pension funds doing that, do you? 2 weeks, 3 weeks ago, last Wednesday, when it was the Tory conference in Birmingham, where Cameron was delivering a speech, he stated that the NHS is safe in his hands. Don't believe it. We, the KUK strikers, are living proof that he is a liar, that the NHS is being dismantled brick by brick right in front of your eyes. They call it reforms, but it's privatisation. Today is our 87th day of action. None of us has made this decision to strike without a lot of soul searching, but I can assure you that if the people that we care for are being asked why are you striking, I'm sure they would say fight on. We effectively are their advocates and speak for them, and we are saying to the wolves of the private sector, you are not welcome in healthcare. Now, on Monday the 21st of October, no, it's Tuesday, sorry, we have been invited to speak in the House of Commons with our brothers and sisters of striking Your Choice Barnet. This is going to be chaired by Jeremy Corbyn MP, and also in attendance will be other MPs. We have invited Ed Miliband, but I don't think he'll turn up. He won't even turn up on our picket line. We are his constituents. Like the Labour government is supposedly defending the NHS, why doesn't he turn up on the picket line? No, we've yet to see him. Now, tomorrow, we've actually got 3 of our strikers going to meet him. We'll be asking certain questions, and what the answers to those questions will be made public. At this moment in time, it doesn't really feel like Great Britain, does it? Because we are losing our national identity. We're becoming the 51st state of America, where the pursuit of wealth and greed is the holy grail. And we are being stolen by the parasitic, capitalistic vultures of the private sector. And we must stand together and fight these people. This dispute of ours, in my opinion, is the most important since the miners' strike. Just as the Tories destroyed the mining industry 30 years ago, the Tories of today are attempting to destroy the NHS. People are looking to us as a test case for if we fail, the ramifications for the public sector and the trade union movement will be catastrophic. Financial attacks on teachers, nurses, firemen and railway workers who represent the backbone of this great country is an attack on the working class. Telling us to budget whilst awarding themselves substantial pay increases is reprehensible. So we must stand together, for if we do, we can effect change and bring this corrupt government down to create a new order where it's people before profit and not profit before people. And that's where we are at the moment. Thank you.
Thank you very much, Andrew. We really appreciate that you travelled all the way from Doncaster to fill us in. It is an incredibly important and symbolic strike, absolutely, and it serves to demonstrate the absolute danger of outsourcing public services to profit-making companies. As an act of solidarity, we'd like to present you with a cheque from Tower Hamlets Unison to take back to your branch for your strike fund. Now, we know that you have to get away and catch a train, is that right?
Yes.
Yes, so we thought we'd do the presentation now so that if you need to shuffle off, you can. So I'd like to present him on behalf of the branch. £500 and also £86, so a total of £586. Thank you very much for all of this. Right, so moving on to our next speaker is Naomi Beard. Naomi is a GP at Jubilee Street Surgery, and she has led the Save Our Surgeries campaign with amazing results. So thank you for coming, Naomi, and I'll hand the mic to you. Would you like a seat or do you want to stand?
Hello everyone. You have to excuse me because I've got a cold and my voice might be going a bit. So,
See your doctor.
no, not for colds. Don't come see me about your cold. Okay. It's a real pleasure to be here tonight, and thank you very much for inviting me. It's always an amazing experience to be among people, among the public, because this is where change actually happens. And you know, the people of this country, the people who receive the services that we're talking about are the ones who need the voice, and it's very, very important that your voice is heard, our voice is heard. So I've really been asked to speak a little bit about something of what the council has said about the services and how it affects us as a practice in this area, and also a little bit about what we've done as a campaign. So there's a lot of talk about community services. I think one of the things about a fight and a battle like this is that you actually have to really think about what it is you value, what it is that actually makes a service important. And I'm sure the mums of your nursery have really thought about that. And it's an exercise that I think we should all be engaged in, actually trying to define what it is that we value, which might include the ethos behind things, the service aspect of a service, the equity, the ethical principles behind the services that we're providing, to define those and articulate those. And then the services themselves, what is it about those services that people appreciate? Whether it's relationship, continuity, the person, the fact that somebody is been there a long time and can follow through with you and knows the family, and these are things that are extra to the whole value for money thing that has always been talked about. And value for money should be defined by the people who use the services. Value is defined by the users, and I think it's really important that in any campaign to stand up and fight about cuts, that we really understand what it is we might lose, and that we articulate that and make that very clear. And in community services, obviously one part, if we're in community, one part inevitably affects the other. So when the council talks about cutting services and the NHS being able to pick up the tabs, that is a total misunderstanding of the situation that's happening across the community, because there's not one area of this community where cuts aren't being affected. And we've been looking at and what's been happening with the funding in general practice and in primary care as a whole. So does everybody know what primary care is? It's that first point of call for healthcare. So it's your GP, it's your health visitors, it's all the services that you access immediately from your home. We're looking at the projected cuts in primary care that have been suggested for our surgeries, for our practice surgeries. It's going to be approaching £7 million into our Hamlets. It's a massive amount, and it's not true to say that we can pick up other services, and it's not true to say that the services that are being cut will not affect the delivery of healthcare. Of course they will. And they will affect the most vulnerable in our communities. And it's so important that we fight because of those people who are going to be affected. I looked at the consultation document, and apart from, well, obviously you know the services that are being affected most, but they use words like efficiency review, consolidation, reduce duplication, review, and their favourite, reconfigure.
And streamline.
Streamline, thank you. And of course they're all... yes, more, you know. And it's just so depressing, isn't it, reading those words, because you know what's behind them. And they're just sort of fancy words that really say cut, cut, cut. And really, how in such a short period of time can anybody possibly plan a good service, a reconfigured service in this short period of time? And how can they do it without consulting the people who are actually using that service and delivering that service? It's just impossible and it's wrong. And the problem with this whole thing is just the lack of proper planning. And I would really, ask that that's one of the things that we challenge the council on. Now, if we speak about my practice and what we've done, we are just one of a number, but we just happen to be one of the first to be affected by the cuts that the government proposed, or NHS England proposed to practices. And they proposed a cut in GP funding, or a change in the way GPs were funding, and they proposed it because they said that they wanted more equity. And this word really bugs me. Because it's banded around as though it's something, really, really great, which of course it is. But we all define equity very, very differently. And their definition of equity was to basically slam the poorest practices in the country. The practices that serve the poorest populations, the most deprived populations in the country. That's how they organised it. And they claimed that they didn't realise. And so we found ourselves in the position last February of looking at the balance sheet, looking at what they were proposing and saying, we just can't survive. And we had to make a decision then, were we going to kind of lay down and die, or were we going to fight? And we decided for two reasons that we were going to fight. We decided, one, because we know our patients. We have a wonderful group of patients who we've got to know. I've been in that practice for 26 years. So I know a huge number of the patients, and those kind of relationships are really important. So we decided to fight for the patients, and we decided to fight because we knew we provided a good service over and above, and we didn't believe that anyone else could provide that service better than we could. And why should therefore that service be taken away? So we set out to define what it was we did, and we set out to cost what it was we did, because that's the language they understand, money. And we proved what we did, and the cost of our services was good value for money. Now there's just no argument against that. If you prove that what you do is valuable, that your service users love it, and that you are cost effective, if you prove that, there is really no way somebody can turn around to you and say, it's not right that you should be here. You just can't do it. And so I would sort of urge a really focused, if you can, as far as you can, a focused effort to look at what things cost and why they're of value, because this is the proof, this is the evidence behind the action. And then the other thing is to believe. Believe that you can do it, believe that you can go forward, believe that you can make a difference, because you can. And we were just a small practice. I know we've got 11,000 patients, but relatively speaking, we're a small practice. And we're now known to ministers. Even the Prime Minister knows about us, and the Secretary of State, for Health knows about us, and Simon Stevens, who's the CEO of NHS England, knows about us. He knows us by name. We were just a little practice, but because we challenged the system with good evidence and with an ethical and authentic voice, then we were listened to, because they couldn't actually stand against that. So I would really encourage you to keep going. Let's work together to try and stand against these bullies, really, who are kind of out to create the most incredible extension of the divisions in our society. We are a community. We want to stand together as a community and support each other and help each other through this.
Of malign influence in our schools, and if it's real, we should deal with it. But our schools are at risk of all of the achievement and the attainment of our young people being undermined, and we're at risk of our community being divided. It feeds into the broader issues that we're talking about today, about uniting and about working together, and about protecting the services and the resilience of our community that we all rely on. So I'm really looking forward to hearing more today from people who work for and use local services. But I just wanted to, I suppose, be clear with you that I can't promise that this is all going to be okay. I don't have that ability. But together, I think we have the ability and the power to stand together and to protect what really matters to us. Thank you.
Thank you, Councillor Saunders, and I think you have raised some important points. I think the first is actually we do want our elected members from the different parties to be scrutinising the recommendations of senior officers. As we pointed out, we now have Robert McCulloch-Graham, the former director of Barnet, and Helen has explained what happened there, so we don't want any repeat of that in this borough. Can I ask now Deputy Ollie Rahman, are you able to take the mic? Thanks.
Thank you, John, for your words earlier, and thank you for inviting me to come here this evening. And I also want to hear, because some of the things that I have heard from here today that I haven't heard probably before. Apart from, I know there's a nursery in my own ward in Stepney Green is affected, and I was contacted by some of the local residents, and I was the person who proposed to extend the consultation period, because one thing I've also just suggested that local councillors also get invited to those consultation meetings and they have an input into that meeting. But also, I have a number of hats, and I was on a strike myself yesterday as a part of a PCS member and office rep that I've been for the last 14 years. And as John said, I'm now myself facing victimizations and politically motivated attack from the company that I work for. Now, basically, so I can understand when parents say the cuts that they are facing, and all along, a lot of people may not see me publicly say certain things, but I can assure you I make myself very clear. And there's a number of people in this room who I call my friends, who have, because of their support and help, I am here where I am today. Because if people like them didn't help me, I never would have probably got elected in the first place. So I don't forget the route that I come from and the route. And I was the first person when Labour was in administration to present a motion to stop the council properties being sold to hand over to registered social landlord. And obviously that did happen. But this is why one thing I will say, and to the mums, I'm more than happy to accommodate a meeting for yourself to come so I can listen to your concern and take them back to the mayor, and I can bring the officers down also to listen to your concerns, to make sure the concerns are listened to, taken on board before any final decision is made. And John has my contact details. If you want to take and contact me, I'll be more than happy to do that. But also I want to say one thing, and a lot of people may agree or disagree with that, but I feel the reason we got re-elected and Mayor Rahman got re-elected, because people of Tower Hamlets at least feel that they have got some sort of good service from this administration. And this is one of the reasons that we sincerely believe that they have returned us to the power. Now, I said this, a lot of people may agree, and a lot of people may disagree with that particular comment. But I can assure you one thing, before any decision is made, all the views and concerns will be taken into account. We haven't, as of yet, close any children's centres and any nurseries where especially disabled children, and that will be also taken on board. And I will certainly, after tonight's meeting, I will certainly make concerns clear to the mayor and concerns of the mums and local residents to the mayor, and also to the cabinet member for resources and cabinet member for children, schools and families, because they are the people who directly engage with officers on a daily basis. So I will certainly do that. I'm more than happy to work with you, and one thing I will agree with Rachel. There's some of the things that, yes, me and Rachel will disagree probably pretty much on everything, but then when it comes to certain issues where affecting the local communities and local residents and the most vulnerable in society, I, for one, will be more than happy to work together to find a solution and to protect the services that most matters to the communities and to the vulnerables in our community. So if anybody want to contact me, if anybody want to raise your concerns, your issues, more you tell me, the more I will know, the better opportunity I will have to go and provide feedback, because some of the services that you clearly are being affected by, unfortunately I'm not fully aware of, because I was the cabinet member for children's school families, but until before the election and after the election, obviously I was moved from that particular portfolio. And I will also, as I said, that I will talk, and also if you have any other meetings that you want me to come and you want to talk to me, or you want me to come and listen, I'm more than happy to do that. Because one thing, like the lady said here, if I and my union leader Max Worker said the same thing, if you fight, you got a chance to win. If you don't fight, you got pretty much, you can guarantee yourself that you would lose. So you are fighting for what you believe in, and if I believe in something, I will continue to fight. And if you genuinely believe in something, I would urge you to continue to fight, because that's what you believe in. And so if you contact me through John, I'll be more than happy to meet with you guys and take your concerns forward before consultation ends, before any decision, final decision is made. Because I know that when the officer says one thing, but also when it comes to the ground, the parents or the users may have a different experience, and that's what I also want to hear. Thank you very much.
All our services were cut and closed on the spot. 11 children's centre, 12 children's centre in 2011 with no consultation with the public were closed. And so we are very wary as parents how decisions are being made. And our consultation, we don't call it a consultation. We said it before, it was really an insult.
I think everybody agrees that the consultation, the way it's been run, hasn't felt like it's genuine and meaningful, which is one of the reasons that we have invited elected members along tonight, so they can hear from parents, from service users and from the people who are running those services what the reality of cutting those services would be. And I'd like to thank Councillor Rahman for agreeing to take the issue of the nursery back to the Mayor. There may be a number of other issues we would like to invite you to take to the Mayor. And, you know, I'm sure there's the voices and the stories you'll hear from other people that may move you as much as the mums and the nursery. So we would invite you to do that too. I'm going to move on to Michael Clark, who is a supervisor in the in-house home care department, which is in the frame to shut a year early.
Hello, my name's Michael, and I've worked in home care for 27 years in January. This is about the fifth time that I've had to be part of meetings or a campaign to try and argue to keep my job and to keep this service. It's the second time in about 4 years that I've had to do that. I don't really understand why people have got such a problem with home care. And the idea that you pay people who mostly live locally a proper rate of pay to do a job for people who all live locally. I just don't get it. And I don't understand how politicians don't see the value of that, particularly in this value, in this area, in this borough. The idea that you have the people who live here, who are completely mixed as any group of people in the country, having their services provided by another group of people who are mixed, a lot of people who don't even speak the same language, people who have been integrated into society through work. I just don't understand how politicians don't get the value of that and see how that is something to actually be really proud of. The idea that there used to be a slogan in social services about the way we do things here, and at the time I can remember thinking it was pretty cheesy. This is about 10 years ago. But this is a particular place, and it's a particular way of doing things that is important. And it's the way that we do things here, and who we do it for, and the message we send out to people that is the important thing. People are just looking at the cost of something, and they're not looking at what it says to other people. Every single person that works in home care, from up to my level, including myself, the vast majority of us are not had a university education. We're just ordinary people who were not sure what we would have been doing if we weren't doing this. We could have been a lot of different things, but all of us are paying taxes, all of us are being integrated into society, and all of us are doing something that we're proud of, and that is worth doing. And I don't understand why politicians don't get that and see that that's what kind of glues London together and makes it work as a place, and makes people who come here without an idea of how they're going to survive and function, learn to function and fit in. I just don't get it. And I think if the politicians could actually look at not just home care, but all of this. So home care is probably the biggest example of it, because we're the least skilled on average, and we're doing the lowest paid work. And if you think that you need to drive that down to the lowest possible pay level, then what are you saying to the people who live here? What are you saying to the people who receive the service? But it's the same for all the other services that we're talking about. It's the way that it's the message you're sending out to people and the way you want to do the work. Even people are kind of like units of legal requirement that need to be fulfilled, or they're people that live here, or they're people that need a proper wage to say this is what you're going to, this is how you live, and you send that message out not just to the person that's doing the job, but also to their family, to people that know them, to other people who don't know how society works, and it actually says, you're working and your kids can work. I actually think we should be expanding the things that the borough does. I think we should be having proper apprenticeships. I think we should be taking back lots of things that we're passing out to people because they're cheaper as a unit of work to actually pass out this week, this month, this tax year, but we're not thinking of the implications of it in general. We should be teaching people stuff, we should be bringing people in, and we should be spending our money on ourselves and improving the way that we act, think and treat each other. And listening to you saying about the Labour Party coming up with these ideas of privatising things, it really is important. You lost this borough because of the way you behaved, because of the policies that you came up with. And you've let the fools in who don't have any thought for how the place is run and what we want to do and what we need to do to make it work for everybody. It's just made a space for, it's the lack of integrity in the past has made a space for these people that we need to close that gap up and say, we're not going to have that anymore. The only thing that we need to do is always argue from a point of integrity about what we want and why we want it. And it's not always going to be cheap, and we need to confront people that just say, it's cheap and that's how we're going to do it.
Thanks, Michael. And I think it's worth just adding in, about a year and a half ago, the CQC did unannounced spot inspection of our in-house home care and found it to be an excellent service, judged them excellent, and we're looking now to shut it a year early, which is an absolute tragedy that we're looking to shut an excellent service even earlier. I think realistically we're probably not going to get through everybody who wants to speak, and we have to be cleared up and out of this room by 9. But I do want to ask somebody from the Child and Adolescent Mental Health Service to speak, because that service is in the frame for a massive cut. It's proposed to cut every single social worker from that team. Now that is a team that provides specialist psychological and mental health services to children and young people with mental health problems in this borough. And we're looking to lose over 10 social workers from that team, which will reduce the capacity of that team by 25%. But what is also a disgrace is that the way it is presented in the consultation bundle, it's presented as it won't make any real difference to children's ability to access a CAM service, and it's also saying that frontline social workers and the social care teams can pick up their work. I'm one of those social workers. We absolutely cannot pick up their work. We're on our knees, we're already flat out, and we don't have the specialist mental health training and skills to do the work of our CAM social workers. So this is a cut that I'm very passionate about, because it is going to have a devastating impact on some really vulnerable kids in this borough, and we have to fight to keep these very skilled workers. So can I ask someone from CAMS to take the microphone? Thanks, Linda.
Hello, thank you for inviting me to speak tonight. Yes, I'm one of the social workers that's going to have my post deleted in CAMS. That stands for Child and Adolescent Mental Health Service. There's 8 social workers and 2 administrators that are planning to be axed next year. There's been social workers in this service for the last 35 years. I've been involved for the service for 15 years, and I've been a social worker in the borough for 24 years. We think these cuts are perhaps one of the most draconian that I've ever come across since working in the borough. As been talked about by my NHS colleagues tonight, CAMS is cited also in the health service. And for the past 5 years, we've been cut every year, possibly have lost about a third of our service to date. The current proposal is that we're going to lose another quarter of the service on top of that, so we're constantly shrinking. CAMS provides a very good service for children and young people and their families who experience high degrees of emotional distress. We work with children and young people who are self-harming, who are actively suicidal. A report in Young Minds about 6 months ago, and reported in the tabloid press, says that services in accident emergencies are completely overrun, can't cope because of the increase in children and young people who are self-harming and coming to hospitals, and that is basically up and down the country. So if you cut our service even more than it's cut already, where are these young people going to go? CAMS also offers services for children with disabilities, for children with learning difficulties, who've got ADHD, ASD, and we provide a service for children looked after. That's if children who can't live with their parents or families for whatever reason. So you cut this service, you're not going to have much left, sadly, in the borough. It's going to be a huge knock-on effect. Basically, we do a lot of preventative work. So the social care area office will probably have an increase in child protection referrals. They're already coming in at about 60 a day, because we stop a lot of those coming to social care. And also, you take the social workers out of CAMS, and you'll see an increase in adult mental health services, because as I said, there won't be any service left. Now, I don't know about you, but I get really angry when I hear people say, "Oh, well, Linda, we've got hostile Labour politics. There's no money." There's actually plenty of money. There's lots of wealth in this country. There's more billionaires per household, per population, per head per population, than any other country in the world. I just find that amazing. So tax the rich. Make sure multinationals pay the tax that they're due, and so on. But that may save some of the money. And I say to councillors, who is anyone here tonight,
join us in the sort of broad-based campaign and just for other councillors to join in, not just attacking the vulnerable. Thank you. Thank you for listening.
Thank you very much, Linda. And I personally want to pay tribute to the fantastic work of the CAM social workers. The children of Tower Hamlets just cannot afford to lose your skill. And I think it's just worth adding to that Tower Hamlets Unison asked to meet with Director McCulloch Graham about this particular cut, because we wanted to put to him the fact that, in our view, the consultation wording really fundamentally misrepresented the work that the CAM social workers do, but also the capacity of the other frontline teams to absorb the work should the CAM social workers be cut. And he just point blank refused to have a discussion about the topic of misrepresentation. So he just wouldn't discuss it. But we want to discuss it, don't we? We want to discuss it. If they're going to make this sort of cut, a 25% cut to to services for vulnerable children, we want to discuss it, and we're going to keep discussing it. Okay, now I know we're running out of time here, but I'm wondering if Emma and because you're involved with one of the services who are looking to be cut, whether we could ask one of you to take the microphone. Thanks.
Thank you very much. I'm really very happy to come in here to talk to you about the cuts. I met the union on the 1st of October at the town hall. Then I went up the cabinet room, sat down, wanted to say to the cabinet the views that we have had. Unfortunately, we were not given the chance. Only Michael and one of the ladies, just to speak for 3 minutes. And then they said that you have to wait. And I waited until they finished the meeting. And I presented a paper to Robert and told him what is going on is absolutely wrong. He didn't even have that paper, a report about the way the council has been treated in such a way that it's a good council. And that was done by African Family Service through the activities of the pastors and community leaders. Robert didn't know anything about that report. Then they have what we call information store. And I went there on Saturday morning. It's supposed to be 11 to 1. I went there, sat down there, and there was no response. On my way back at 1, I asked the customer service, what's happening? They said they've cancelled this information store. They will start between 3 and 5. And that is the nature of the so-called consultation that the people should have. So I told Robert, I came to the cabinet meeting to tell the cabinet what is going on is wrong. Because the people you expect to see, to talk to them about the cuts, are in various places, not the place you said you wanted them to be at. And he apologized for that. I'm here today to support the cuts, those who are fighting for it. And I just want to give a proverb in my language, native language. It says, if you have nothing to give to your mother-in-law, you don't steal from it. That's all I have. If the council, that is Tower Hamlets cabinet, members do not want to help the children, at least they should keep their nursery. They shouldn't steal from them. That's what it's really emotional abuse, in my view. Because if the children get up and all the nurseries have been closed, what do you want them to do? And the effect that will have on them is something which is really very serious. And I saw this lady passionately argue that the nurseries shouldn't be closed. And I support her totally. The second bit, which really surprised me, is that, African Family Service has been established in Tower Hamlet, the first of its kind in England and Wales. They have been doing a fantastic job meeting pastors, meeting the congregation, meeting the residents in the areas, those who don't want to come out or go to that town hall to ask for anything because they are afraid, they don't fit in. Recently, on the 27th of July 2014, David Cameron said, well, we have to do something about harmful practices. Spilled possession, female genital mutilation, private fostering. All these are some of the programs which affect the black people living in Tower Hamlets. Then we turn around on the 1st of October, I heard that service is going to be cut. It is the same service managers who call on the African Family Service to gather the pastors, the community leaders, to argue for Tower Hamlet. And they got the report which says that Tower Hamlet has a very good practice in engaging black children and families in the Bible. The African Family Service is exceptional and excellent, and they are doing a very good work. That was 27th of February this year. Then on the 1st of October, that service is going to be deleted. And what they did was to write a patchy report about the service. The idea is whoever read that report will say, no, get rid of it. My point is that with all what is going on, Ajua Grumbi's situation, Christopher Barno in Newham, if we don't retain this service to get to the root of the problem, helping them to solve these problems, we will have a serious case review in Tower Hamlets. And I believe that all of us, we must come together and work against the cuts. Thank you very much.
Thanks, I think when you're talking about Robert, we're talking about Robert McCulloch-Graham again, aren't we? The Director of Social Care. And I think it is also worth highlighting that Tower Hamlets Council won a Quality Peer Challenge Award from the Local Government Association. It was last year, and the council's very proud this year, very proud of that award. It's got it hanging in the hallway next to the council chamber. And one of the reasons that the council won that award, and anyone who looks at that report can see, one of the reasons they won it was because of the excellent work of the African and Muslim Family Service in doing outreach work and reaching Muslim and African families in relation to complex children's safeguarding issues. Now this proposal is saying you know, it's not a problem if we lose the service because the core social workers and the frontline teams can pick up that work. Now, I'm one of those social workers and I'm absolutely clear we can't pick up that work. We don't have the sort of skills that someone like Emma sitting at the back has, and we do not have the time to do that work either. And it is really important that we look to do what we can to try and keep that service. What I'm going to do now is I'm going to sort of finish up because I know a lot of people want to speak, but time is ticking on. I think it's been a really good meeting, and I think we've had a chance to hear sort of the voices from some of the main services affected in terms of the people who offer those services and some of the service users who receive services. So I'm going to finish up now, but it's been a wonderful meeting, and I think it's really important we take away from this meeting a renewed commitment to keep fighting these cuts. We're going to do another lobby. Hopefully you've put your email and contact details on the door as you came in, because we will be looking to make contact with you to continue this journey around fighting the cuts. So what I'm going to do now, I'm going to just give John McLaughlin the microphone to do a bit of a finish up. John?
I just want to make a couple of points. A lot of people had to leave because people had caring commitments and they need to go. But really, I think one thing I've got more than anything else from this meeting is really a very simple message. We are not going to give up our services without a fight. I said two things at the town hall. One was to quote the great American revolutionary Malcolm X. He said, "The hinge that squeaks gets the oil." And we need to make sure on all these services we make as much noise as possible. I think it's excellent that we made the Deputy Mayor come to this meeting and give a commitment to meet with people, but we have to make sure that they hear the noise that people aren't going to accept them. The other person I quote, who's not a great revolutionary at all, is Arnold Schwarzenegger. One of his films, he said, "We will be back." And I think we have to say to the council, we will be back outside the town hall on the 5th of November, and we will not allow them to make a cabinet decision to close these services without a massive fight. It's been a very good meeting because of two things. One, the sense of solidarity. One of the things I'm really pleased about, it seems to me that the way these cuts are being designed is designed to make people try and fight against each other. To say cut this rather than cut that. Do it to that service, not our service. What I've heard tonight is people saying, yes, we care directly about the service that we work in or we're provided, but we're here to defend all our services. And I think that's a message that needs to go loud and clear, both to the Labour Party, but also to the Mayor. Because when I sit in meetings with our senior management, what they say to us is this: by 2020, we'll reach a situation where local government is half the size that it was in 2010. And that we should all just sit back and accept that and take it lying down. Well, I put it to you, if you allow that to happen, you will destroy lives for working class people. You will destroy it. You can talk about what we've done in our schools, but everything that's been done to improve life into our habits, to get more equality, to provide a chance of starting life and to look for elderly, that will be destroyed. And therefore we do need to say to our politicians, come and stand with us. Stand with the service users. Stand with the workers. Together we are going to fight to save them. And I think that's a fight worth having. And I'll give commitment from our branch and for all of us, we are going to fight right the way through.